Well, 2 hours ago, I spoke about collagen injection, and we have much more materials in the world, like collagen hyaluronic acid, hydroxylapatite, and PRP, fat injection, or PLLA, polylactic acid, or sometimes D form lactic acid, and polycaprolactam. As far as I know, we have this kind of injectable materials. But today, I'm talking about a new type of injectable material. It's made of sugar. It's called algenus. It is a new type of injection material. Botanical, it's from plant. The content is the interaction of a new type of filler, and what is material made of, and what kind of treatment is suitable for it, and how to use, and complication. Of course, many materials may have some complications. And what should he do if complication occurred? These contents today. You can see the materials. The number 3 is polysaccharide. 1 is collagen that I talked about today, and bovine in person and human. And hyaluronic acid. This is now worldwide and the most used injectable material. And this is polysaccharide. I'm talking about this material today. And fat, hydroxylapatite, and botulinum toxin, and polylactic acid. Polylactic acid, you have Cure White in China now. It contains collagen and polycaprolactam. And what is algenus? Algenus is a new type of filler, and it's made of agarose. We call it sugar saccharose or glucose, but this is agarose. Agarose is made from seaweed. You can see the plant in the sea. And it's a botanical filler, and almost no chemical materials in it. And it contains only oxygen, hydrogen, and carbon molecules. So it sounds very safe. And this is the agarose molecule. And you can see their molecule type, only very simple. And it'll be very long. Poly, like from here, OHN and HN is all combined, and a very long material. This is what can be seen here. This is agarose in it, algenus, and they have 2 syringes in one box, and one is empty. One contains material and needle, and ourselves have to prepare this connector, the empty syringe, and 2.5 cc of syringe, and this has 0.5 lidocaine. I put a little bit, 0.1 or 2 cc of lidocaine into this material. It contains 1.2 cc and a bit more, and I mix. And what kind of treatment is suitable for the agarose? Augmentation of the nose, chin, temple, or concave on the face, or anywhere, but I usually use for the face. The shape of the result can be remodeled within several days. this is a very great advantage because other injectable materials, it's quite difficult to remodel. Once you inject, the shape is settled, and soon after, like hyaluronic acid, you can change the shape a little bit, but you cannot imagine that the H2O will be absorbed to HA, so the shape will be different. And it can apply to also, nasolabial lines or oral commissure, like Margaret line. A layer of injectable materials. First, collagen. I spoke today, very superficial for wrinkles and usually superficial dermis. And hyaluronic acid, HA, that can be injected anywhere, usually for deep wrinkles and augmentation, deep dermis or subdermis, sometimes near the bone, sometimes in the muscle. And agarose is for augmentation and the same as fat layer. Sometimes we can inject subdermis, but if it's too close, there's some complications. Deeper, it's okay. A fat augmentation, of course, fat layer. And hydroxyl apatite augmentation and also to the fat layer, or near the bone sometimes. And botulinum toxin, this is for reducing the movement of the muscle, so very close to the muscle. Actually, muscle-nerve junction is the target to use it for botulinum toxin. And 7-polylactic acid should be placed in subdermal layer or a little deeper. And it will, you can see the effect later, and it'll take some time, so it'll be changed. Here, agarose, where we had took. This is epidermis, dermis, and this is the fat layer. Usually, this layer you can use for agarose. And how to use. Cannula is good to inject this material, not a sharp needle. And a small area, 30 gauge, 25 millimeter of cannula, or wider, like 27 gauge, 50 millimeter, or sometimes 70 millimeter. And make a little hole for the inserting the cannula, a small hole for cannula, and observe the area of injection and feel, though I inject with right hand, and touch the area with the left hand and see how I'm injecting here. You have to feel where you're injecting. And when excessive amount has been injected, massage and make the area smooth. You can massage it. Soon after, you can remodel. And this is where to inject. Like it says video, but I think I forgot to put it. Oh, yeah, I did. Thank you. To make a hole with the 27 gauge and inject agarose. This is mouth, and this is oral commissure. Oral commissure here. And this is the hole with 27 gauge and using 30 gauge cannula. And this is mixed agarose. You can see the injection. And touching with left fingers, I make sure where I'm injecting. and to change the direction, stick out and insert again to the place where I want to augment. And this is about it. Takes only less than 1 minute, I guess. And complication. Algenus should be injected to their subdermal layer. If injected into their dermal layer, redness and bump will occur. You can see here, superficial, and here, deeper. And this is about 5 months. You can see to their superficial layer, you can see this kind of red prompt complication. And if it happens after 5 months, it's very difficult to treat. You have to just wait, or sometimes hyaluronidase may be effective, but very difficult. And this is nose augmentation with a case of Algenus. You can hear, and this is soon after treatment. I injected somewhere around here, and injected here. Also, Algenus case number 2. Also for augmentation of the nose, and 0.3 cc of Algenus with a 27 gauge 50 millimeter cannula. This is before, and this is soon after. In the same case, the side view here is before, and this is soon after. In the same patient, case 2, before, and this is 5 months later, still effective. You can see the difference. Now, not much changed. These cases, it's okay. See, the same case with the lateral view before and 5 months later. You can see the height of the nose. And case number 3 with Algenus, nasolabial fold. This is before, and mapping here, where to inject. Not to the dermis, subdermal area. And 2 weeks later, you can see how different it is. That's very effective. It will last for several months to maybe 1 year. And this is case 3, actually case 4. This is before, this is concave, you can see. And soon after, and 4 months later, it's effective. And you can use it just like hyaluronic acid. And case 5, this is 4, but this is case 5, sorry. This is before for the oral commissure, 0.4 cc for each side. I mean, 0.4 and 0.4 each before, and this is after 1 month. You can see the difference. And case number 6, complication, excessive injection. This is before. You can see the concave here. And I injected agalose somewhere around here, make a hole on long 50 millimeter 27 gauge cannula. 1 week later, I found that there are 2 bumps here. In that case, what shall I do? See, I injected saline and massaged. For complete excessive injection, I injected saline injection and massaged. This is before. You can see the prominent area. And injected saline soon after the shape. And 2 weeks later, this is before, and 2 weeks later, you don't see anymore, just a little bit here, but almost no prominent area. So within 1 week, you can massage and change and remodel the prominent and complications. So it's quite safe, and we'll be relaxed to inject. So I'll tell again, what shall we do for the complication? Saline injection to the excessive area is very effective. This should be done within 1 week. Well, maybe 2-3 days or up to 7 days, it may be possible. And important thing is to avoid too much injection. In that case, I just relaxed and inject too much and bumpy. Then massage soon, but anyway, it's not so good, and I have to remodel again. And when I think I've injected unevenly, like I did to the temporal area, massage injected as soon as the agarose is injected. And if the deformity appears, you have to see and inject saline as soon as possible, within 7 days. And the area is effective within a week. So if complication happens, it is very important. And if you inject agarose subdermal area, this may be the only complication that I have. In conclusion, agarose is like hyaluronic acid. Actually, hyaluronic acid has absorbed water in the tissue, and the shape will be changed. Comparing soon after and several days later, the area will be swollen. And we can sometimes see patient with nose augmentation with hyaluronic acid. And several times the nose will be wider and wider. And we have to use hyaluronidase. In this case, agarose, it doesn't have any water and be swollen, so it's possible. And using agarose, you can get a shape which you can see right after the treatment. Agarose should not be injected to the superficial layer, like dermal area or superficial dermis. It's very dangerous, so please don't do it. When deformity occurs, you can save the area with the saline injection within 7 days. That's very important. That's about it. 谢谢。